Dr. Mills, and welcome to the GI Health Summit. Thank you so much for being here.
Well, thank you for inviting me, AJ. It is wonderful to be here and looking forward to sharing a lot of good knowledge.
Well, I can't wait to talk to you because you wrote a paper that's really intriguing, and I'd like for you to talk about the racial bias in the U.S. dietary guidelines and why that's significant for some people that have GI problems.
Sure. And it's actually really interesting. And first, I'll talk about the provenance of how the two-part paper that I did in conjunction with PCRM came to be published. And after I finished my residency at Georgetown, I was working in the outpatient clinic setting, and I had these experiences where over and over, older persons of color were coming in to see me complaining of bowel problems. And they would say, Doc, my irritable bowel syndrome is acting up, or my spastic colon is really starting to bother me. And I would do a very careful history and find out that they were continuing to include dairy products. And notice I said dairy products, not dairy foods, because they're not food, they're products in their diet. And I would ask them to go home, do a trial of absolutely no dairy whatsoever. That's no milk, no yogurt, no cheese, no ice cream for 2 weeks, then come back and see me. And in truly 85 to 90% of the cases, the problems had completely resolved. And so I would explain to the individuals that they didn't have spastic colon or an irritable bowel, that the problem was that as a person of color, they could not digest the sugar that is in dairy products, lactose, and that is what was causing the symptoms that they were having with the cramping, the bloating, the pain, the diarrhea, and so forth. And that if they eliminated those products from their diet, that those problems would resolve. But the sort of penultimate moment came when this one African-American woman came back, and she had done exactly what I asked her to do. And I asked her, did the problems resolve? And she said yes. And I then sort of, with a sort of sense of satisfaction, said, well, see, you're lactose intolerant, and that's what's causing the problems. And she looked me square in the eye and said, oh, I know that. And I was literally just kind of blown away. And I said, then why are you continuing to eat these things? And she said, because the government says I have to. Right there in the dietary guidelines, it says that we have to have X number of servings of dairy products every day. And so I eat these because I need it for my health, or at least she thought she did. And I didn't show it to her, but internally, I became very angry and upset because I knew what she did not know. And that is that the US government has known for well over 100 years that, number one, dairy products do not help build strong bones, number one. All of the research that's been done on that has shown that dairy calcium does not strengthen bones, reduce the incidence of osteoporosis, or help prevent hip fractures. In fact, most of the data suggests that the more dairy products you consume, the worse your risk of hip fractures. But even worse, the government has also known that the vast majority of Americans of color, and you can extend that worldwide and say that people of color around the world are lactose intolerant. They cannot digest and absorb the sugar that is in dairy products. Therefore, when they ingest dairy products, it's going to make them sick. But then there's a third issue, and that is the government also knows that for some reason, African American women in particular are genetically protected from getting osteoporosis. And we really don't understand why, but what we do know is that African American women just don't get osteoporosis unless they have some other disease process that causes their body to lose calcium. So here, the government was encouraging people of color to consume products for no nutritional benefit that it knew was going to create disease in these individuals. And for what reason? It's simply so that the producers of dairy can make money off of these individuals. And that is the quintessential definition of institutional racism. And it is a form of economic pimping of people of color for the benefit of wealthy dairy concerns. And it is truly, truly unconscionable and unacceptable. And so I approached Dr. Neil Barnard, who's the head of the Physicians Committee for Responsible Medicine, or PCRM, and presented this situation to him, and he agreed that we needed to address this issue. And out of that, we did a two-part paper examining the institutional racial bias that presents itself in the United States dietary guidelines. And so part one of the paper, it was a two-part paper. Part one focused exclusively on the issue of lactose intolerance, which, to just give you the numbers, in African Americans, the prevalence is 73 to 75% of African Americans are lactose intolerant, 94% of Native Americans, 95% of Asian Americans, and 53% of Hispanic Americans, versus only about 30 to 33% of white Americans. Now, I want to kind of point out two things to you. The gene pool of Native Americans and New World Hispanic Americans is pretty much the same. They were the indigenous people who were living in North America when Europeans arrived here. But you notice that the prevalence of lactose intolerance in Native Americans is much higher than it is in Hispanic Americans. Why is that? Well, it represents the penetrance of European genes into the Hispanic population. And if you were to check the prevalence of lactose intolerance in West Africans, it's 95 to 99% versus only about 75% in African Americans. The vast majority of Americans of color cannot tolerate the sugar. But it also goes beyond that, because part two of the paper addressed the other chronic diseases that are related to the consumption of not only dairy, but other animal foods, which are, again, are heavily recommended by the dietary guidelines. And so, for instance, prostate cancer. Prostate cancer in African American men is 60% higher in terms of prevalence than it is in Caucasian men. But once we as African American men develop prostate cancer, we are more than twice as likely to die from it, because we get much more deadly and aggressive forms of the cancer. Well, the number one risk factor for developing prostate cancer is the consumption of dairy products, because of their high estrogen content, the fact that American dairy industry uses a lot of growth stimulants and anabolic steroids in the production of dairy cows and to stimulate their milk production. And also because cow's milk in and of itself has a plethora of growth stimulants in it, because it's designed to take a calf that weighs about 60 to 80 pounds at birth and blow it up to 1,000 to 1,500 pound animal by its third birthday. Well, you've really got to be stimulating growth in that animal. And when humans ingest those proteins and those growth stimulants, it causes prostate cancer in men and breast cancer, uterine cancer, and ovarian cancer in women. So, and it's also been linked, I should say parenthetically, to colon cancer in humans as well. So, but these cancers and the heart disease and diabetes that are related to the consumption of dairy products reach disproportionate levels in communities of color, so that they tend to develop these diseases earlier ages, much more aggressive forms, and they tend to die sooner. Now, I want to be crystal clear. Am I saying that, oh, people of color can't eat dairy foods, but white people can have a party? No, because it is also unhealthy for white Americans as well. but it's just that it will kill people of color sooner. So again, I say over and over, the difference is the difference between jumping from a 30-story building versus a 50-story building. The people of color are jumping from the 50-story building, so we hit the ground going faster, we make a bigger splat, but the white people are jumping from a 30-story building, you're gonna get killed too. So everybody should be avoiding these products because they're not designed for humans. I tell people, I wouldn't recommend consuming cow's milk for a human for the same reason that if a human being needed a blood transfusion, I wouldn't give you cow's blood. It's not designed for humans.
That is absolutely mind-blowing. Would our viewers be able to read these papers?
Oh, absolutely. The links are available online, and I will forward them to you after we're done. And not only can your viewers read these papers, but I encourage them to do it, and they can download the papers and read them for themselves. And there's wonderful information in it. And I will absolutely make sure you get those links so you can pass it on to everyone watching this summit.
Well, thank you. I am white, but I'm also Jewish, and I'm lactose intolerant. And I remember growing up being forced to drink milk, like at school, and vomiting. And even if somebody is not lactose intolerant, dairy products are not good for us in general, but I think our guts specifically. Can you speak to why?
And just to touch on what you mentioned, as you know, the Jewish gene pool, although again it has been mixed in with the European gene pool, stems largely from the Middle East. And again, there is a very high prevalence of lactose intolerance within Middle Eastern populations, and so that of course makes sense. But let me, in answer to your question as to why is it that dairy products are not good for everyone, let me ask you a question. We'll have a little didactic drill here. If I said to you, I wanted you to think about a cow, an elephant, and a giraffe, and ask you, what is a natural diet for those animals? What would you tell me?
Well, when they're little, they're mom's milk, and then afterwards, they're herbivores. So, I mean, I don't know exactly what each one eats, but it's definitely plants.
But it's plants. Okay. And you kind of stole my thunder there, because you know what the answer is. What most people will say, and that's correct, is that it's plants. Then I ask them, well, at what point in those animals' lives do they eat animal protein? And probably 99% of the people say never. And I tell them, no, think about it. And then they realize, oh yeah, it's when they're nursing. That is the only time that they consume animal protein, in the form of their mother's milk. Well, mother's milk, again, is species specific, and it's designed for that particular species to grow that particular infant to whatever size at whatever rate it was intended to grow. Human beings are plant eaters. We are natural herbivores. And I have an entire lecture called Are Humans Designed to Eat Meat, which we can talk about in more detail in a bit, that points that out. When we ingest animal protein as adults, it stimulates our adult cells to try and do something they shouldn't be doing, and that is it stimulates them to try and grow. And since they can't grow normally, what they begin to do is form tumors. Now, the majority of those tumors are benign, and that's why people get moles and skin tags and lipomas, or they'll get cysts, in various organs. Women will get uterine cysts, breast cysts. Men will get enlarged prostates. People will get cysts on their vocal cords, but also frequently that abnormal growth will actually turn, frankly, cancerous. And that is why study after study after study has shown that the more animal protein humans eat as adults, the higher their risk of developing cancer. And in fact, one study that included over 45,000 individuals, followed them for 18 years, showed that those people who ate the most animal protein had a 75% risk of premature death and a fourfold increase in cancer. So there is no question that animal protein, when ingested over the lifetime of a human, increases the risk for a variety of diseases, including cancer, but also metabolic diseases like diabetes, problems like heart disease, hardening of the arteries, stroke, high blood pressure, and so on, because it is not the normal and natural diet that we should be ingesting.
That's interesting that we're not designed to eat dairy, yet they make pills and even kinds of milk called lactate so that they give us something so that we can digest something that we're not even meant to digest.
I agree. It's kind of ridiculous that people are giving us, trying to make it possible for us to ingest something that we shouldn't be ingesting. It's much easier not to ingest the product that we don't need. It's kind of like if I had a loaf of bread that had cyanide in it, and I told you, well, look, AJ, don't worry about it, because I got these pills that are cyanide blockers. So here, eat this, take the cyanide blocker beforehand, and you should be okay. Now, over here is a perfectly good multigrain loaf of bread that has no poison in it. But why don't you just gamble with your life and take these pills and see if you're going to be okay? Why would you do that?
Well,
what's the point of it?
The
There's no benefit to it.
The only thing I can think of is that for a lot of people, dairy is addictive. It's sort of like people take their Prilosec so that they can eat food that's going to give them heartburn.
And I'm glad you brought that up, because you're right, dairy is addictive. But before I get to why dairy is addictive, let me just point out that this advertising, these products are put out by people who want you to buy what they're making. This is their livelihood. They make money every time you go out and buy something with cheese on it or buy a container of yogurt. So their job is to convince you that you need this stuff. And when they know that you get sick from it, then their response is, well, we've got this other product that'll prevent you from getting sick. The most absurd example of that, in my opinion, nowadays is this so-called A2 milk. Because now people realize it's not just the sugar in milk that makes people sick, it's the actual proteins in the milk that people are having allergic responses to, that can cause anything from gastrointestinal bleeding to skin rashes. In children, it can cause constipation, flare-up of asthma symptoms, and all kinds of issues. And so they have this so-called A2 milk where they've artificially taken some of those proteins out of it. This is crazy. If you've got to chemically modify a food this much to try and prevent it from making people ill, that's nature's way of telling you, don't eat it. Leave it alone. It's crazy. I mean, nobody's ever had to chemically modify an apple in order for you to enjoy it, have they? No. Now, let me get back to why is it that dairy foods can be addictive? Well, because Mother Nature wants your baby to feed. And the baby needs to feed so that it will continue to ingest calories and grow. So there are actual compounds in mother's milk called casomorphins that make the baby literally feel good when it nurses and ingests milk, and makes it want to ingest more until it's full. Well, those compounds are also in cow's milk. And when you take that cow's milk, and I cannot remember off the top of my head how many gallons of cow's milk it takes to make a pound of cheese. Well, all of those casomorphins get concentrated into that 1 pound of cheese, so that when you ingest it, you are literally getting these very addictive protein molecules that are making you crave this stuff. And so it's all very natural and normal, but it's abnormal because we should not be eating this in the first place. It's just like people who go out and start using meth will eventually start craving it, but that doesn't mean they should be doing it. And the same thing is true with cheese and other dairy products. Yeah, you'll crave it, but you shouldn't have started doing it in the first place. And it's best for your health to break the addiction.
And humans are the only species that even drinks milk after maturity.
Absolutely. And it's certainly the milk of another species.
I think we're the only one that does that.
Yes.
Yeah, this whole thing you were talking about reminds me of people that are on medication, and they're on medication to treat the side effects of the medication, and it goes on and on.
And on and on. And it's really perverse, but it's why for probably the majority of humans, certainly in Western countries, their life after the age of 25 and 30 is a series of ever increasing illnesses. And it's illness after illness and drug after drug and medication after medication. And people have come to look at that as somehow being normal when it is distinctly abnormal. Because in Blue Zone data, which is where they've looked at societies around the world to see which ones are the healthiest, which ones have the least number of diseases, and where the people live the longest and remain the most functional, show that as societies become progressively more plant-based and eliminate animal foods, including dairy products, from their diet, they not only live longer, but they have fewer illnesses. They retain it. They retain it functionality, meaning that they are active, they are involved, they are continuing to do things, to garden, to work, to be involved with their friends and neighbors, and they have a much lower risk of dementia as they age. And there's only one blue zone in the United States, and that's actually found in Loma Linda, California, where the majority of the people there are either vegans or vegetarians. And I should say that there's only one blue zone that has been identified in the United States, because there's very good evidence that there may be a second blue zone in the US in Huntsville, Alabama, which is where a large population of Black Seventh-day Adventists who are vegetarians and vegans live. And they also have a very high percentage of people who live well into their 90s and hundreds and retain their mental faculties and are very functional. And in fact, a friend of mine who is Seventh-day Adventist, her grandmother just celebrated her 105th birthday, and she's still going strong. So there is abundant scientific evidence that being plant-based helps you live longer, remain functional, and retain your mental acuity.
That's a great
105?
That's amazing.
God bless her. That's amazing. And I remember many years ago, I had an ulcer and it was quite painful. And I remember the doctor telling me to drink milk because that would soothe the pain of the ulcer.
And the reason he told you that was because back then, doctors were under the mistaken impression that milk contained a lot of alkali, and that the alkali in the milk would neutralize the acid production from your stomach. But those theories and that practice has been completely debunked, and that is no longer recommended at all. Moreover, we now know that the majority of people who get ulcers, the ulcers come from infection with a bacterium called Helicobacter pylori, which comes from eating animal products. And so that is actually the thing that you need to do is heal the infection and the ulcer will go away. And that when it comes to excess acid production, actually moving away from diets that are high in animal protein and animal fat will also decrease acid production by your gastrointestinal system, which will decrease problems with reflux, what's called GERD, esophageal reflux disease, and ameliorate all of those symptoms as well. So again, changing to a plant-based diet is clearly the answer.
So we know that human beings are not designed to drink milk after maturity, or certainly from another species ever. But we're not designed to eat meat either?
No. And people out there might be saying, whoa, 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 how can you say that? How do you know that? The reason I know that is that you can actually look at animals that are designed to eat animal tissue or eat other animals, and look at those animals that are designed to eat plant foods, and you see very stark differences in the way their digestive systems are put together. And let me see if I can bring up a slide. So this is kind of what I covered before. I asked, what is a natural diet for all of these animals? And of course, it is plant foods. And then I say, well, at what point do they eat animal protein? It's only when they're infants during their rapid growth phase. And that's why animal protein is a potent growth stimulant in plant eating animals. And this is when what I was mentioning, when we look at the digestive tracts of plant eaters versus meat eaters. So on the left here, you see that with the meat eaters, the carnivores, they have very, very short digestive tracts, but they have a huge stomach. And at a single meal, they can eat up to 30% of their body weight. So that means that a 300-pound lion can eat up to 100 pounds of meat at a single meal. And this is because carnivores are intermittent feeders, meaning that because hunting is inefficient, they'll make a kill today, but they may not kill another animal for another 7 to 10 days. So they have to be able to eat enough at this meal to last them for a week or more until they make another kill. Herbivores are very different. All herbivores have small stomachs and that's because plant foods contain fiber, which means they take a lot of processing. So the herbivores, therefore, have to eat a small meal, process that meal, then go back and eat additional meals. So they have to eat multiple times every day just to get enough calories to last a single day. When we go back to the chart on the left, we see that the small intestine of the meat eaters is very short. And that's because meat doesn't have any fiber, is broken down and absorbed very quickly. So you don't need a really long digestive tract. And as a result, they have a very short small intestine. It's only about 3, maybe 4 times their body length. And then when it gets to their large intestine, the large intestine is short, straight, smooth, because they want to get that residue out before it starts to putrefy and release toxins. When you skip over to the right side of that chart, you see that the herbivores, as I said, have a small stomach because they've eaten multiple times, but they have a very, very long small intestine, which tends to be, this is 9 times. It's actually more like somewhere between 10 to 12 times the body length. And again, that's to allow the processing of the plant foods. Then they also have a very long, large intestine that has a pouched, as you can see, pouch structure there, because there's still a lot of fiber and water that's left over after the nutrients have been extracted. And the bacteria in the colon, or their microbiome, will act on that fiber to break it down into things called short-chain fatty acids that the animal can then absorb and derive additional energy from, but it also helps adjust their physiology in very beneficial ways. So we know that for humans, the short-chain fatty acid butyrate not only keeps the colon healthy, but reduces the risk for colon cancer. Another one called propionate brings down cholesterol levels, brings down blood sugar levels, and can reduce the risk for other types of cancer in the body. And then finally, the herbivores have an appendix attached to their colon, whereas the carnivores do not. When we move over to the structure of the teeth, what you see is that both carnivores and omnivores, like bears and raccoons, have teeth that are designed for ripping and tearing apart animal tissue. So they have very long dagger-like canines. They have sharp blade-like premolars and molars. And in bears and raccoons, they do have a few of their molars that have been changed to be used for crushing. But for the most part, their jaws act like a pair of shears to slice food off or meat off bone, and to allow them, again, to kill and dismember animals. When you get over to the herbivores or the fruit eaters, and of course the humans, you see that we have flat spade-like incisors, flattened nodular molars, and what you can't see in this diagram is that the jaw joint in the plant eaters has moved to a position above the plane of the cheek teeth, and it allows the jaws to a lot more freedom in its motion so that they can grind up their food. Whereas with the meat eaters and the omnivore, the jaw joint is on the same plane as the cheek teeth, and it makes the jaws act like a pair of shears. If people will go to YouTube and type in "Are Humans Designed to Eat Meat?" that lecture will come up, and it has pictures of all of this in much greater detail, and it will show them all of this information, as I said, in a lot more detail so that they can really understand this. I think it's something everybody should educate themselves about and acquaint themselves with, because it will help them understand why they should modify their diet. You know what? Let me just bring this up really quickly since I do have it. I'm going to hit share again, okay? All right, so here, all right, so you can see from this comparison that human beings have the jaw structure and the teeth just like the horse and nothing like the wolf down at the bottom. And you can see even horses have very small canines like humans, but they're not used for meat eating at all. And you can see that this area called the angle of the mandible is expanded in both the horse and the humans because we're both plant eaters, but not in the wolf or other carnivores or omnivores. That should be really clear to everybody.
You know what I think isn't clear to everybody, even though you said it? That meat has no fiber, and neither does dairy. I don't think a lot of people even realize that animal products lack fiber.
Okay, so what's the difference between animal food and plant food? Well, when you look at animal tissues, an animal cell has a cell membrane that's made up of fatty tissue. Inside the cell, there's proteins, some fat, some water, but there's absolutely no fiber. And that's why meat eaters do not require a very long or elaborate digestive tract. You contrast that with plant tissues. And as we all know, plants don't have bones, right? So they use fiber to stiffen and protect their tissues and to resist gravity. And that means that every plant cell, in addition to having a cell membrane, has outside of each cell membrane a cell wall that is made up of cellulose. And that is what makes the fiber. And so that means that if you are eating plant tissues and you want to get at that nutritious part of the plant that's inside the cell, you've got to disrupt that cell wall to extract those nutrients, which is why all plant foods have to be chewed in order to rip apart that fiber so you can extract those nutrients. Animal food doesn't have to be chewed. If you've ever watched a carnivore eat, you know they just chew off a hunk of, or slice off a hunk of meat and swallow it whole. They don't chew their food. They don't need to. But plant tissue has to be chewed in order to be adequately digested. And then because of all this fiber, it takes much longer to digest that food. That's why all plant eaters or herbivores are batch feeders. They will consume a stomach full of food, process that meal, but then they have to go back and eat another meal in order to get enough calories to last even a single day.
Unlike the snake who can feed maybe once a week.
Well, yeah, because it's a meat eater.
Right, absolutely. One of the things all the experts on this summit are saying is that fiber is critically important for our health in general, our gut health, and our microbial health in particular, and diversity of fiber.
That is absolutely true. And all right, so there are two types, but many varieties of fiber. Here are your water-soluble fibers. They're gums and pectins. They have a slightly slimy quality. The poster child for water-soluble fiber is okra, but it's found in all sorts of different plant foods. Again, protects against heart disease, diabetes, inflammatory bowel syndrome, colitis, and a number of cancers. And then there's the water-insoluble fibers. These are the kind that don't dissolve in water. Cellulose, hemicellulose found in beans, lentils, whole grains, and other foods. Protects against colon cancers, constipation, diverticulosis, hemorrhoids, inflammation, and helps improve our immune function. And these are just showing you the studies that I used to retrieve that information. This slide shows that the bacteria in our colon actually help activate the compounds in the fiber. And as a result, breast cancer risk was reduced by up to 22% in women who had the highest intake of a type of fiber known as lignans. Whole grain rye was shown to reduce prostate-specific antigen in men who were already diagnosed with prostate cancer. Consumption of soy phytoestrogens, which again is healthy, reduced breast and prostate cancer risk in men and women in a dose-dependent fashion, meaning the more you ate, the lower your risk. And it was the metabolism of these phytoestrogens by the type of bacteria that we adapt when we eat a plant-based diet that made them more bioavailable. High fiber diet reduces the risk for breast cancer, according to a systematic review by the American Cancer Society. Fibers prevent formation of a bunch of carcinogenic toxins like hydrogen sulfide, ammonia, a variety of other sulfides and toxic amines. It also traps heavy metals, toxins, and other compounds in the stools and helps them to be eliminated from our bodies. And they, as I mentioned before, are fermented to these short-chain fatty acids that of themselves have anti-cancer properties and benefit our physiology in a number of beneficial ways. And this is a picture taken from Scientific American that shows that when you have a lot of fiber in your diet, you produce more goblet cells, which secrete a thicker layer of mucus, select for healthier strains of bacteria. They keep the bad guys away from your intestinal mucosa. You can see your colonic cells have very tight junctions, so you don't have this leaky gut syndrome forming that can happen when you don't have enough fiber. And they also program your T regulatory immune cells so that your immune system is functioning much more efficiently. And one of the chief compounds is a 4-carbon short-chain fatty acid called butyrate, which helps modify our DNA in ways that reduce cancer risk. The short-chain fatty acids, again, help reduce leaky gut, which lowers the risk for autoimmune diseases and promotes a healthier microbiome, which improves immune function and increases production of these cathelicidin peptides, which help augment antiviral and anti-infectious properties in our system. So those are just, again, some of the ways that being plant-based and having a healthy microbiome help us ward off disease.
Amazing. Fiber's almost magical in what it can do.
Not only is it magical in certain ways, what is crystal clear is that you cannot be healthy without having a high fiber diet. That is just, people have to understand that. Fiber is not something that's optional. Fiber is something that is necessary for humans to have the optimal best health.
A lot of the doctors are saying that health starts in the gut, and that you can't be healthy without fiber. Your gut can't be healthy without fiber. And yet, what do Americans eat? 92% of their calories from animal products and processed foods. Two categories, and I use the term food loosely, they have zero fiber.
Yes, you're absolutely right. And the other thing that I think is important for people to know is that food spends more time in the colon than any other part of our digestive tract, which is where the microbiome is. And it's there for a reason. It's there so that the bacteria have time to break down that fiber into those beneficial compounds that I was talking about. But if you're not eating the fiber, then the bacteria have nothing to work on and they're not able to do their job, and you don't receive the health benefits you should be getting from your diet.
And then the people on the carnivore diet or the keto diet, then they have to take fiber supplements.
Well, not only that, but all of the data is now showing that those people are at higher risk for premature death. They have higher rates of cancers, higher rates of diabetes, and higher rates of heart disease, which comes as no surprise because that is an unnatural diet for human beings.
Right. You know, there seems to be, not seems to be, the literature shows there's a strong link between processed meats and colon cancer. We know that meat's not good, but what is it about deli meats that make it even worse for people?
Well, let's go to the videotape. Because that's a very important question. And I actually have a couple of slides that address that directly. All right. So the World Health Organization has classified processed meats as a class 1 carcinogen, which means they are in the same categories as cigarettes. So they are as prone to cause cancer and as deadly as smoking tobacco. And that would mean hot dogs, sausage, luncheon meats, ham, smoked and cured meats, and the one that people always are talking about, bacon, are all processed meats. The nitrites, which are used to cure these meats, form these carcinogenic compounds called nitrosamines, which are very potent carcinogens that attack and damage the DNA in our cells and increase the risk for a variety of cancers. Studies have shown that pregnant women who eat hot dogs have children who have a higher risk of developing childhood brain tumors, which is the number 2 cause of pediatric cancers. Children who frequently eat hot dogs have 10 times the risk of developing childhood leukemias, which are the number 1 pediatric cancers. Childhood leukemias and brain cancers have been increasing more than twice as fast as other childhood cancers over the last 2 decades, and is most likely due to increased intake of these processed meats. Processed meats also increase the risk for bladder, endometrial, prostate, thyroid, throat, esophageal, gastric, and colorectal cancers, among other problems. So, take-home message is processed meat will kill you.
Yeah, and we've known this for a while, and yet people continue to eat these foods.
Yes, and it's because of the advertising that occurs on TV encouraging people to consume them. You can't turn on any program without seeing a commercial, that's touting some fast food restaurant that's, putting bacon on everything. And it's for me, I find it disgusting because they are encouraging people to do things they know are going to harm them without telling them the potential risks. And it's really unfair to encourage people to consume products that are going to hurt and harm them without making them aware of the risks that they are incurring.
Well, maybe animal products should come with a warning label, much the same way that cigarettes and alcohol do.
I believe they should. I believe that would only be fair. Yeah. And in fact, there is a move amongst some groups of doctors to require warning labels on cheese, particularly for high-risk individuals like pregnant women and other groups, to let them know that they are putting themselves and their babies at increased risk by consuming these products.
Wow. Colon cancer this year seems to be on everyone's mind with the death of the actor Chadwick Boseman.
Yeah, and that sadly, Chadwick admitted that prior to his starting to train for the Black Panther movie and prior to his diagnosis, that he was a huge meat eater, that he ate lots and lots of red meat. And we know that red meat is directly related to increased risk for a variety of cancers, but particularly colon cancer. Again, I mentioned earlier that for people of color, when adopting Western style diets, it puts us at even increased risk. And so, whereas the medical profession recommends that your average American start colon cancer screening at age 50, the recommendation for African Americans is going to change, that we start screening at 40 to 45 years of age because of our higher risk when eating a Western style diet. Now, I want to emphasize that that's when eating a Western style diet, because when you look at West Africa, where they're still eating a primarily plant-based diet with hardly any meat, no dairy, they don't have increased rates of colon cancer. So, and then when you look at the Adventist health studies that looked at plant-based African-American Seventh-day Adventists, they didn't have increased risks of colon cancer and other cancers. So it is the diet that is causing this. It is not the background genetics.
Right. I remember I was fascinated by the work of Dr. Dennis Burkitt. He said he could not find almost any diseases in Africa. You know, you had mentioned how Seventh-day Adventists often have excellent health and longevity. Many of them don't eat any meat or dairy, but the Seventh-day Adventists I know also do not consume coffee or alcohol. Do you think that impacts their health favorably in general, and maybe their gut health in particular?
Certainly, I think it could be playing a role in certain respects, but the good, to sort of figure that out in terms of these major chronic diseases that we're talking about, because approximately half of Seventh-day Adventists are still use meat and dairy, and half don't, they can, to an extent, serve as their own control group. Because to be a member of the church, you cannot use alcohol, you cannot smoke cigarettes, you cannot use, as you said, coffee. But because within that construct, you still have half of the people who eat meat and dairy and half not, you still see a huge difference in disease risk and life expectancy based on just excluding the meat and the dairy from the diet versus those who don't. So it still comes down to the animal foods as being the primary culprits.
Yeah, so let's start there. Fascinating. So, Dr. Mills, what is the truth about GI health?
The bottom line is that we are plant eaters, and that to the degree to which we adopt and adhere to a plant-based diet, not only will our gastrointestinal tracts be happier, we will be healthier, our bowel habits will be normalized, and we will be in and out of the bathroom before we know it. And you won't need a hazmat suit if you have to go in after someone. And you will live a much longer, much healthier, much happier life if you adopt and adhere to the diet that we're designed to eat. And that is a diet comprised of entirely plant-based foods once we are weaned. And I want to emphasize that very young children, less than 3 years of age, should be consuming the food that nature intended them to consume. That's their mother's milk. Once they're, I would say, more than 18 months old, you can start to wean in some softer plant foods. But, do not try to make a newborn baby or a 1-year-old a vegan, because their digestive tracts can't handle it. They should be consuming their mother's milk. But once they're out of that toddler phase, they should be plant-based, and they will be much healthier and live a much longer and healthier life for it.
Thank you, Dr. Mills.
My pleasure. Thank you for having me.